get started before we get too delayed. This month, welcome back everyone to people who have come back and welcome to our guest speakers. Thank you for coming and joining us tonight to share your perspectives. We're going over autoimmune conditions this month and our tagline, The Body Fights Back. I would like to live with them. So March is Autoimmune Awareness Month, which is why we coordinated this month with it. The color is purple, as you can probably tell from the size. So disclaimers, as always, this is not medical advice. If you're concerned about any of these issues or think you may have them yourself, please talk to your doctor. And as a reminder, these people's experiences do not represent everyone with their condition. There's a wide range of symptoms and things people experience with each various condition we talk about. So if you don't already and are interested, please follow us on social media. Our Instagram is Invisible Illness Loyola, and we have our QR code, which links to our link tree, and we have a bunch of various stuff on there, including all of our previous presentations, the condensed versions of them. We also have a YouTube channel where we upload our guest speaker meetings, and obviously our email list where we send out for events, and you can find all of our presentations on our link tree. And if you have any questions throughout this presentation and do not want to say them in the chat or out loud or in person, please use this QR code to access our Padlet, and you can submit anonymous questions there, and we can relay them to the guest speakers through there. So some key takeaways from our presentation a couple of weeks ago. An autoimmune disease is a condition where the body's immune system attacks healthy cells. It disrupts the body, and autoimmune conditions can be treated by many doctors depending on the condition, but they're most often treated by rheumatologists, sometimes in conjunction with other doctors like endocrinologists. Lupus is a condition that affects the entire body, especially causing pain, inflammation, and fatigue. Sjögren is when the immune system attacks the salivary and tear ducts, but it can also affect the rest of the body. Graves' disease is an autoimmune thyroid condition causing too much thyroid hormone to be made, which is also called thyroid. This causes symptoms such as weight loss, palpitations, and heat sensitivity. People with autoimmune conditions often have or are at risk of having other autoimmune conditions. And a brief little slide on Hashimoto's thyroiditis, because we have a guest speaker who is sharing their experience with that today. So Hashimoto's is an autoimmune condition of the thyroid. It's basically the opposite of Graves' disease in terms of symptomology. It's a type of hypothyroidism, which is too little thyroid hormone. And symptoms include fatigue, weight gain, sensitivity to cold, constipation, muscle weakness, aching, general pain, joint pain, and goiter, which is an enlarged thyroid. It's thought to be caused by genetics and environmental triggers like infection, stress, or radiation exposure. And you're most likely to have it if you're assigned female at birth, are middle-aged, have another autoimmune disease, family history of it, pregnancy, excessive iodine intake, and sometimes other medications can cause it. Diagnosis involves testing thyroid hormone levels and antibody levels, and treatment is thyroid hormone medication. And if you have experienced gout, sometimes surgery to remove all of parts of the thyroid is expected. There are some complications, but it mainly happens with untreated goiter, heart problems, mental health issues. There are poorer pregnancy outcomes, and I'm going to butcher that word.
Mixed edema, I believe.
Edema, there we go. A rare life-threatening condition caused by long-term severe and untreated hypothyroidism. And there are comorbidities, as with many other conditions. Other autoimmune diseases, including celiac, lupus, rheumatoid arthritis, Sjögren's, and type 1 diabetes. So today we have 3 guest speakers. We have Wynne, Barbara, and Madison to share their experiences with us today. So thank you guys for coming and being able to speak. We really appreciate you guys giving your insights. If you guys want to say a brief introduction about yourself, maybe like name, where you're from. If you want to share what condition you are talking about today, that would be great too, if you feel comfortable. Anything of that sort.
Hi, I'm Wynne Edelman. I also happen to be Sarah's mom. And among my many conditions, I had Hashimoto's thyroiditis. That actually got resolved because I had to have my thyroid removed, not specifically because of the Hashimoto's. I had a nodule which because of location, I assume was not a goiter. They called it a nodule. And I ended up having surgery and ended up with diffuse cancer. Anyway, long story you don't need to hear about because you're just here to learn a little bit more about Hashimoto's. So Barbara, take it away.
Okay, so I'm Barbara Spalding, and I'm Wynne's friend, happen to be, and I'm here to talk about both lupus and Sjögren's today. What else was I supposed to say? Anything else? No? Okay, Madison, your turn.
Hi, I'm Maddie. Just I feel like I'm Madison if I'm in trouble.
Oh, so sorry about that.
No, you're fine. I'm from Brisbane, Queensland in Australia, and I have Graves' disease, and it's quite a new thing for me. I think I was diagnosed like 2.5 months ago. And prior to that, I have endometriosis and PCOS. So this is just a lovely thing to add to all those other issues. So yeah.
Awesome. Well, thank you so much, guys, for being willing to speak, especially you, Maddie. I know the time change is massive, but we appreciate it. So what is your experience with autoimmune conditions, if you don't mind sharing? Well, you guys already shared your diagnoses and what you're going to be talking about today. But as a general, to kind of sum up your experience, either with the medical system or just what you've experienced.
I would say that there are not a lot of experts on autoimmune conditions out there in the world. You totally need to educate yourself about the conditions. You need to advocate for yourself because until you manage to get yourself to a knowledgeable doctor, you're not likely to get yourself diagnosed. So you have to continue to chase after solutions to your problems, which is true of any kind of illness. There's a lot of doctors who won't admit that they don't know everything. And that's a real problem.
And especially with it being difficult to diagnose autoimmune conditions, is there's not one specific doctor that specifies autoimmune diseases for all across the board.
Barbara?
Well, and off of that, some are treated by rheumatologists, some I would imagine are treated by endocrinologists because like the Hashimoto's thyroiditis would be.
And probably Graves too.
Oh yes, Graves, yes, that's true. I have been dealing with lupus for probably, it's been almost 34 years. It took 4 years for them to finally diagnose it. I went from doctor to doctor and not rheumatologist to rheumatologist because I didn't even know what lupus was. I didn't know it existed. And it just, one doctor would send you to another and then another. And I was at the point of saying, forget it. It's all in my head. I give up. And my gastroenterologist said, no, it's not. Please, one more doctor. I'm going to send you to a rheumatologist. And that's how I finally was diagnosed. It just seemed like my body was falling apart, but I didn't have a reason why. So it's not that I wanted lupus, but I wanted to know what was going on and how to help it. The Sjögren's wasn't diagnosed until after my first son was born, so 26 years ago.
Wow.
And there aren't, lupus is much more common than some of the other diseases, but doctors don't only have to be able to diagnose it and know what treatments out there, they actually have to keep up on their education. I've run into recently that my rheumatologist is not doing that. So when I ran into trouble with one of the infusion meds, he's like, well, you know, I don't know what else to do for you. That's not what you want to hear from a rheumatologist. So,
No.
so
Wow.
there's room for improvement.
Yeah.
Which is why we have a club like this. Hopefully helping future healthcare professionals.
Mm.
How about
Yeah.
you?
Yeah, it's really interesting because I actually feel like I got really lucky with Graves, lucky in terms of it was diagnosed really quickly. But it also like came on so quickly because I'm quite a healthy, fit person, and I went from normal life to my quality of life was awful. So yeah, the diagnosis was lucky that it was so quick because we could act really fast. And I haven't had that experience with doctors in the past, so I was just very lucky. And I have also seen an endocrinologist now, and they were amazing. And I felt like the endocrinologist compared to my GP, like the knowledge was so much better with the endocrinologist, as you would expect. But when I was diagnosed, number one, I had never heard of Graves before. And I think it's a terrible name because I freaked out and thought I was going to die. And everyone around me, family, friends, no one else had heard of it either. So I think that's where I like turned to TikTok and like YouTube and to find other people who had the same thing, because yeah, I just felt like even the GP like didn't really explain it to me. Like I got the diagnosis, but I had no idea. And especially with the eye bulging thing that can happen with Graves, like there was just not enough information, I would say. Yeah.
Definitely.
Mm.
Wow. So what if you haven't shared already, what are your worst symptoms with the disorder that you guys have? And when did you start experiencing symptoms? I know Barbara touched on that a little bit, but what generally do you experience as symptoms, and when did you start, and when did you start seeking help?
Well, I was heading on 55 when I really started to have significant symptoms. I had some symptoms prior to that, but didn't really realize what was going on. And basically, my symptoms were hypothyroid symptoms, typical hypothyroid. And although at the time I didn't know what it was, I thought maybe, oh, there was, like some kind of virus, Epstein-Barr, something. I mean, I wasn't having the right kind of symptoms for that, but I was so tired, I was gaining weight, fatigue, constipation, losing my hair. A symptom that wasn't on the slide that you showed earlier was very heavy periods. Anyway, I started out with my GP, and I got your typical TSH and T4. My numbers were fine, which normally they would not be for somebody with Hashimoto's. And I went from the GP, I went to an endocrinologist because, of course, I researched and said, okay, this sounds like it might be a thyroid thing. Well, the doctor had actually suggested that, but I kind of, validated and, okay, go to an endocrinologist because that's who would treat it. And anyway, I ended up going through multiple endocrinologists before anybody was willing to do the antibody testing, because everybody said, oh, well, your numbers look fine. And then I had antibody testing, and that showed that my numbers were definitely high. I had both the anti-thyroid perioxidase and the anti-thyroglobulin antibodies. And that's a pretty certain sign that you have Hashimoto's if you have both of those things, even if your TSH and T4 numbers are okay. But I had to go to, I think it was 3 endocrinologists before I found somebody who was willing to actually test me.
Wow. That's a lot.
Okay, so for me, my worst symptoms are joint pain, my hips, my knees. It's the fatigue. The fatigue is honestly like no other. To say I'm tired isn't I'm tired. It's my body is not wanting to do anything. I'm exhausted kind of thing. I can sleep a whole night and wake up and I still don't feel rested. But I would have to say the worst symptom that I've had from the lupus is that it caused gastroparesis. So I have a feeding tube, which I was grateful for because I lost 50 pounds in 3 months from not being able to eat or drink or keep anything in my system. And I was told that it was rare that lupus could cause gastroparesis, but you have no idea how many people I now know that have lupus and gastroparesis. So maybe it's only rare for that doctor, but you
I
know.
do believe we did gastro conditions last month, and I do believe that lupus was, we covered gastroparesis. I think lupus was on the list of comorbidities.
Yeah, see, you
Everyone
know
knew
that.
what osteoporosis was, so that's good.
Yeah, you know that. I know that, but my doctor, not so sure. And for the Sjögren's, it's the mouth dryness and the eye dryness. Your eyes feel like sandpaper at times, you know, and you can easily scratch your cornea by just rubbing your eye because it's so dry. Talking sometimes, in the midst of talking, my mouth will be so dry, my lips will actually stick to my teeth. And it's a little hard to talk like that. So those are probably the worst symptoms I've had.
Yeah, wow. That's crazy. Yeah, for me, the first thing that I noticed was I felt like I was going to faint or throw up all of the time. And my muscle weakness was the thing that came out of nowhere. So yeah, I didn't understand as well that with Graves, you can have muscle weakness and like your bones can start to deteriorate if it's not, you know, taken care of. And my hand tremors, like I still have them even on like the medication that I'm on. So that was, yeah, awful. And then my heart rate, like I have a really low heart rate. Usually it's like 45 and it was like 115 when I was sitting down doing nothing. So that was like terrifying. So I thought originally something was wrong with my heart and that was like scary. And then the other thing is like heat sensitivity. That's pretty bad. It's definitely better. But yeah, I felt like it was taking over my life because I was like, I fainted for the first time in my life. I just like couldn't get out of bed because I wanted to throw up or like I was too weak. And yeah, it honestly affected everything. And then I started to lose weight really quickly. That stopped as soon as I started taking medication. But yeah, it all happened so fast. Yeah.
So what kinds of things make your condition or conditions better, and what makes them worse? And have you found any ways to cope with the symptoms that you experience?
Well, I was put on a very low dose of, it wasn't the Synthroid that I'm on now because I have no thyroid. It was Cytomel. And although I had to fight for that because my TSH numbers were still okay, so they didn't want to treat me at all. But then I went on the medication and that did help. Oh, one of the symptoms I forgot to mention was extreme brain fog. I had actually gone for testing to see if I was having early,
Alzheimer's?
What'd you say?
Alzheimer's? Like
Alzheimer's, yeah. See, I do have it.
no, you don't. Thank God you don't.
yeah, I got tested because I just couldn't hold on to anything. That's how bad it was. Anyway, the medication did help lessen my symptoms. And then I started having some other thyroid issues and ended up with the surgery. But so I can't talk to the long-term what you might need to deal with, but it's either you get no medication for it or you get low dosage of some kind of thyroid medication.
Okay. For me, what helps the muscle pains and stuff like that, I go for massage therapy every week. And it's not like the ooh ah nice. It's my muscles are all constantly tight and and the connective tissue is even tighter. So it's kind of painful, but it relieves enough that my pain threshold can restart. That's why I go every week. I'm glad you guys shook your head and you understood, because other people don't understand. It's like, you're dealing with so much, and then you'll go for a chiropractic adjustment or a massage, and then it kind of resets. And then over the course of the week, it happens again. Okay, you go and you do it again. I will say it is frustrating that that I can't seem to make progress in keeping my muscles from acting like rocks. But the massage therapy is a good thing. Chiropractic care is also, for me, to keep the lupus kind of calmer. Making sure I get enough sleep is important, and keeping the stress kind of, as much as I can control it, low. Those things help make it better. What makes it worse? Unfortunately, the past 5 years, my lupus is like it never was before. It was easily controlled by Plaquenil, and now I'm on multiple medicines because it's just active, and it's just changed a lot of my ability to do things. So so if I do things that I want to do, then the pain and what I pay with is pain. So if that made sense.
Yeah, I'm super similar to you, Barbara, with like stress and overdoing it. Like if I overdo it, I feel it for like days and days afterwards. Yeah, what really helped me was the medication that I got put on. I feel like I was lucky because the medication they put me on the first time worked for me, and I didn't have to go backwards and forwards and find something new. But I was put on a really high dose. Like I went from taking no medication to 12 tablets a day. And that, yeah, it helped my levels get better. But I guess overall, it's still like, I very much have Graves. I had a blood test, a follow-up last week. And I think, yeah, if I skip a dose, I can tell instantly, which, yeah, it's just that reminder that I am still dealing with this. And I think the whole, like, there doesn't seem to be a light at the end of the tunnel. Like you don't know how long you're going to be on this medication for, or if you'll go into remission or you won't. So yeah, I think, yeah, it's tough. But I did get some good news with being able to halve my medication. So I'm trialing that at the moment to see, but yeah, it's a day at a time thing for me. And yeah, as long as I keep my stress low and take my medication, I'm, yeah, the best I can be, all things considered. Yeah.
So, for those of you who haven't shared this already, what treatments have you tried so far? What has worked and what hasn't worked? And, are you in the middle of trying anything now?
Okay, Wynne, do you have any?
No, I,
Okay, all right. Then I guess that would be me. So for the lupus, I've tried, the first thing they give you is Plaquenil, which is an anti-malarial drug, but it helps with arthralgia and it helps with lupus. It actually also helps with Sjögren's. And I'm not sure, it might help with Raynaud's, but I'm not positive. So I started with Plaquenil, and then after I would have each of my sons, I have 3 sons, and after I had each of them, I would have to go on steroids because the lupus would it would flare worse after each pregnancy. Prednisone is helpful in that it makes you feel like you can do all the normal things you used to do, but it's hard when you come off of it. There's like a little bit of a rebound, in which you feel absolutely awful. So and I don't like the feeling of prednisone in general. It causes nightmares and all other kinds of side effects. So I try to stay away from that. Duloxetine is something that my rheumatologist gave me because although it is an antidepressant, it has a side effect of helping with the muscle pain. And it really does work because I did have to stop it in 2021 for a brief period of time. And boy, did I realize how much it was helping when I couldn't take it. And I can sympathize with Maddie, sorry,
No, you're good.
on how many pills you take because then they added Cellcept, which is an immunosuppressant, to try and suppress my immune system so it would stop attacking things because it was I have chronic kidney disease from it, and I have it's congestive heart failure, but it's chronic. So that is also very common in people with lupus. Then I was put on Benlysta after I went on the Cellcept because I had pleurisy 9 times in 1 year from the lupus. Then he added the Benlysta. I was on Benlysta for 3 years. It worked well, but it caused depression. And it took me forever to figure it out. But once I did, they switched me to Safnello. Now I just started that. I've only had 2 or 3 infusions. So I don't know how well that's going to work. He was reluctant to even let me try it because it's a fairly new medicine. I think if he had his way, he would have left me on the Benlysta, but I could not live like that. And just as an aside, if you see your friend struggling and you think your friend is depressed, you have to tell them. It wasn't until after I said something that 2 of my closest friends said, yeah, you weren't yourself, but I didn't want to say anything. So those are the medicines for that. And then Sjögren's is infinitely easier for me to take care of because it involves some over-the-counter things like Xylamelts, which are little discs that stick to the side of your tooth or your gum and slowly help create saliva so that your mouth isn't dry. And I use Restasis eye drops and pilocarpine. And pilocarpine is a pill that's supposed to help create some kind of saliva in my mouth. So
Wow. I didn't even know that was a thing. That's so interesting.
Yeah, I didn't either. Thank you for sharing that.
Yeah.
I use the Xylomelt too.
Do
It's
you?
good. Yeah.
And the Oasis spray. There's also a mouth spray.
Mhm.
But I like the Xylomelts better.
Wow. Well, the medication that I got put on was it's called carbimazole, and that's definitely been amazing for me. But what was I guess really interesting, because I didn't really know what my options were, and I had a pretty intense checkup with the endocrinologist where my husband and I actually spoke about like wanting to have children in the near future. And I guess I didn't understand that with Graves, they suggest that you don't have children while you have Graves, which was a really big shock to me. And I wish someone had told me that earlier, because there's a lot of things that can go wrong. But I think the statistics are you're 16 times more likely to have a miscarriage, which is a lot more times.
Yeah.
So pretty much the endocrinologist said to me that I could either have radioactive iodine, which is a very scary thing to like learn about. And then she said, you know, after that, it's like 6 months post, you can then try to have a baby, or there's the surgery where they remove your thyroid, and the same thing there with the 6 months. But obviously with that, then you have to be on other medication to replace the thyroid. And then my third option is to stay on the medication I'm on now for 12 to 18 months and just see if I go into remission or not. And I felt like that's like that they're pretty crappy options, I guess, all three of them. So I just decided what was best for me was to stay on the medication and just, you know, wait a bit longer to try to have a baby. But yeah, it was like really intense conversation that I was so unaware that, like, I guess that they're the only options and that you shouldn't really try to have a baby with Graves. So yeah, I wish more people knew that.
I did not know that. I had
I
no
know.
idea. And then for you, Maddie, it's even harder because you have PCOS. I also
Yeah.
do. And
Oh, okay, you understand.
yeah,
Yeah.
I do. And they're both gonna have to try and coordinate.
Yeah.
Yeah.
Yeah. And they and even like if you go into remission, your pregnancy is so heavily monitored, and that you just have to be really, really careful. And then it's a high risk pregnancy.
Yeah.
Anyway, and because you can, I guess if you fall pregnant when you still have Graves, you can carry the autoimmune disease on like through the placenta. Yeah, so it's
Scary.
crazy. Yeah.
Yeah, Hashimoto's can be passed on genetically if it is a genetic cause. Like, I don't think mine was genetic, but I don't know. I think mine likely was from Epstein-Barr when I was a teenager, but I don't know that for sure. I was surprised that among some other things that are possible causes of Hashimoto's, SIBO. I had never heard that small intestinal bacterial overgrowth can also lead later to Hashimoto's. Radiation exposure, pregnancy hormones. Now, I didn't come down with Hashimoto's right after pregnancy. I had a late pregnancy, so I was a high-risk pregnancy. But my Hashimoto's was like 10 years later, so they don't think it was, you know, connected to that. But there's a lot of reasons. But yeah, the whole area of thyroid conditions can be genetic. I have a cousin who does have strong genetic thyroid issues, so there's some possibility that mine is genetic. And so my daughter Sarah there
I've been
has
tested
to
a lot
have
for
some
it.
concern
Sarah.
there. And Maddie, just FYI, after I had my thyroid removed, I did go through the radioactive iodine treatment, and had to be locked up in the bedroom for a week. And I had food, it was kind of like, I know what people living through COVID and having to isolate was like, because
We would put the food at the top of the steps, and then we would walk the other way and yell when we were far enough away.
That's
yeah,
crazy.
it was pretty crazy, but it wasn't that bad. I mean, you live through isolation, but other than that, I didn't have any, well, I had some mild issues, but nothing like terrible that, continued on. It was relatively short term. But I only had to have that treatment one time. I don't have any idea how, would you need to have more than that or not, but.
Yeah, that's good to know. Thanks for letting me know that.
So, what in general has your condition or conditions changed for you? Like how you live your life, how you do activities with other people, or just in general, how you continue living your life?
Well, when I was dealing with it, I would say it was mostly a matter of, did I have the energy to do things, or did I have the focus to be able to do my job? I was really running into issues at work because I just did not have the same kind of focus that I'd had, and my ability to remember details it got really awful. And so, there were real effects on my life. It wasn't, like a life-threatening kind of situation in any respect, but yeah, it was definitely significant, and was what really drove me to continue to try to find the cause and the solution to it.
Hmm.
Well, for me, when I first started the Plaquenil, it worked, and I became more awake and I hurt less, and I thought I could go on and just go back to my normal. And then I kind of realized that I needed to change my expectations of myself and what I could do and what I couldn't do. Which was a challenge for me because I kept thinking in my head, I'm only 23, not now, guys, back then. Far from 23 now. But I would think, I'm only 23, I should be able to do this. So I would do it. And then my body would say, you shouldn't have done that. So it was a little bit of change in that way. But now that the lupus has gotten so much worse, I mean, it caused PEs, which changed my lungs, and generally I wear oxygen if I'm moving around and stuff. I can't do things like I used to. Like I love to quilt and craft and crochet and make cards and just do things, clean. I would love to be able to go through and clean my whole house top to bottom in one day, not 1 week. It kind of, either it takes it away totally or it changes it, and you have to try and adapt to how it's changed you and what you can do and be happy with what you can do. And truthfully, I have tried to always maintain a positive attitude, minus the depression from the Benlysta, but because that helps keep me going. It makes it easier if I look at it in a positive way than if I get wrapped up in all that I can't do now that I used to be able to.
It's so nice to like hear your stories, because to know that you're not alone in it, because sometimes I think you can be like, I'm the only one that's going through this, especially if no one in your direct circle is going through it. Because I exactly the same. And I feel like at the beginning, especially, I almost felt like I was grieving my old life, because I was like, that's not anymore what I do. Exactly the same. I couldn't clean the house. And I was like, I'm young, but I feel like I'm really old now. I was going to bed at like 7 p.m. and like, yeah, it was just, yeah, not good. So and especially like I was a very, I used to be a personal trainer. So I like loved the gym, and I couldn't go to the gym. And I've only just been able to go back and to just be okay with not being as fit as I was before, or as strong, and just taking things really easy. And it honestly has changed my entire life. Like even the fact of like pushing potentially being a mom 2-3 years from now, and just having to be okay with that. And I actually felt really validated by my doctor and endocrinologist, because I told them I was feeling like this, and they were actually amazing and said, you know, like you should be upset about it. You let yourself be upset and then you can move forward. But they're like, you know, it's actually a big deal. And yeah, so I've just taking it a day at a time and being like, okay, well, if I feel this way today, that's okay. I don't have to complete everything that's on my to-do list, and tomorrow is a new day. So yeah.
For sure. And the grieving process is different for everyone. It takes a long time for some people, sometimes it doesn't. But I know it took me like, I don't even know, like the past year I've been okay with calling myself disabled, but up until then, like I've been dealing with this stuff since I was like 14, and I'm 22 now. So it takes everyone's journey is different, and it takes some time sometimes.
Yeah.
What advice would you guys give to someone who's newly diagnosed or suspected of having your autoimmune condition, or an autoimmune condition in general?
Find a support group. For Sarah's condition, I got involved with a Facebook support group, well, actually a number of them. And then we also went to conferences, national conferences, and
where I met Stephanie.
right. And just, you know, meeting other people who are in your situation is, it's just helpful. I mean, I think you get general support from folks who have any other kinds of similar conditions, just because they've gone through some of the challenges. They've gone through the challenges with the doctors. They've gone through some of that life adjustment that you may have to go through. And, you know, certainly for you with the, you know, having potential issues with having a child, you know, that's a whole lot to deal with on top of the medical issues.
Yeah.
I'm so glad that they, you know, do believe that there are some options for you, and, you know, that it gives you, you know, you may not have an immediate solution, but just that, you know, that thing that you can look forward to, hope for, whatever, you know, keeping that positive outlook and continuing to educate yourself, and, you know, continuing to find better solutions if you feel like what you're dealing with now is not working for you. I know Barbara's had to go through a lot of, you know, pushing forward and keeping that positive outlook. And God, it's so hard when you have medications that don't allow you to have that positive outlook.
Yes. Yeah, I agree. It does make it difficult. I'm very glad my primary listened. And what I did was, just in case anyone ever runs into a situation like this, I knew my rheumatologist was going to say, well, I don't know what to do with you if you won't take the Benlysta. So I went to my primary and said, I need you to advocate for me and talk to Dr. Gutierrez and tell him I must stop the Benlysta. And she did for me. I think I would tell people, you know your body best. Listen to your body, as hard as that is sometimes, because we really do want to ignore it when it's saying sit down and you want to go out. And always advocate for yourself. Don't assume that the doctors are going to know everything and know what's right for you. Advocate for yourself.
Yeah, 100%. And I like with my endometriosis and PCOS, it took a really long time for a doctor to diagnose me, like 8 years. So I feel like that really helped me know my body and when something was wrong. So I think that actually helped me with the Graves, because I straight away went and found a doctor who would actually listen to me and do something about it. So I think, yeah, if you go to a doctor and they tell you that there's nothing wrong with you and you know that there is something wrong, just keep finding someone who's going to listen to you and do something about it. And also I joined like a Facebook group. I think it's called Thriving with Graves, and I love being a part of a group of people who are going through the same thing as me. And funnily enough, I started documenting my journey on TikTok, which is where I found you guys, when we made that connection. And all I do is share what I'm going through, but the comment section of people who have this little community to talk to each other about what they're going through, that's like really special to me, that I love that I got to be that person to create that community. So I think, yeah, just finding other people and also using that information that you found to educate your family and friends, because I feel like they had no idea what it was. So it's actually really helped me feel like they understand what I'm going through more because I've shared that with them. But yeah, that's all, that stuff's definitely helped me.
100%. It takes many people with any kind of invisible illness or other condition, like, to take years to get a diagnosis. Like, I feel like all of us have had, I think, shared like years. Like, I also have endometriosis. It took me 7.5 years to get that. So like it's ridiculous. And that's the whole goal of, trying to come together and talk about our experiences and trying to bring awareness to other people who do not have these conditions, but are interested in the healthcare field to recognize things. Like, even if it's like a couple things, it'd be like, wait, I think I know something around this area, and just kind of give a direction. But anyway, kind of our last two questions, kind of wrapping up. If the public were to know one thing about autoimmune conditions, or yours specifically, what would you want it to be? And same thing for doctors. If you could talk to doctors directly and just be like one thing they generally knew about autoimmune conditions, or the one that you have, what would you want it to be? That was a hard one. There's a lot of things that come to mind for me. So
I'd want doctors to admit when they don't know enough to be able to deal with your symptoms, and to do work to actually help you find other doctors to treat your symptoms. So, they should have more connections than you do to find appropriate doctors. So don't believe that doctors are gods. And I hope that the medical education field takes that aspect out of the program. Too many doctors come out of medical school feeling like they're gods, and they're not. They have some area of knowledge, and I think AI in the future is going to really do a lot in terms of helping to diagnose people, because a doctor just can't know it all. And so the doctor needs to admit, hey, you're outside of my area of expertise. I'm going to help you find the person to take care of you.
Recently, I asked my doctor a question about it's called Lupus coagulant. It's a clotting issue, but you don't even have to have lupus to have it. So I don't know why they call it that. You can not have lupus and have it. But I asked her something about it, and she was very honest and said, I don't know that. And I appreciate that so much more than them trying to push it on as it's you, or give you this long-winded answer that didn't answer anything. So yes. And I know that some of us have said, well, doctors don't listen to us and stuff, but they're not all like that. Some of them do. You just have to find the right one for you. And it may not be who the right one is for me. I would say, if I was talking to the public, I guess I would want to say, and I know this sounds really simple, don't judge me by looks. You have no idea what is going on inside this body. If I use my handicap placard, don't assume that I'm just lazy, like it's upsetting when people do things like that. And for doctors, I would say, don't discount our concerns, and make sure you continue to have compassion for your patients. They do burn out.
Yeah.
Sometimes I think it takes them getting sick or someone that they love before they really can understand, or at least are more compassionate. So I know my rheumatologist went through a long spurt where I swear he was burned out. And this past winter, he stuck his finger in a snowblower and he lost a couple of his fingertips. And I know that sounds terrible. And I was like, oh my gosh, are you okay? And it changed him. He went back to the way he was years ago when I first met him. I think having been a patient and being in that situation where he couldn't do anything for himself made him realize and opened his eyes again.
Wow.
Wow. Yeah, for doctors, I think if they could have more empathy for, especially, I think sometimes they assume that what, if you get a diagnosis like that what that is, and that what comes along with that. And I think it needs to be, and especially when you're in that situation where you get told news like that, sometimes you can go very like brain foggy and not really be taking in what is being told. So I think there needs to be, I don't know, a support person with you, or something else where you have that information to go back to. I really wish I'd had that. And also, like, I had a really bizarre experience with the whole when the doctor was going through what were my symptoms, and they were asking me questions about my eyes, because I did have a lot of the symptoms where I was seeing like double vision and where my eyes were glazed over. And the doctor just like looked at me and stared at me and looked at my eyes, and she wasn't really explaining anything to me. And all she said was, if your eyes get worse, go to emergency immediately. But she didn't explain to me what she meant. And I asked her and she still didn't give me that information. And I don't know if she meant to do that, but it was quite a scary thing because she didn't give me that information. I went home and Googled it. And when I Googled it, that's a really terrifying thing to see, where your eyes can pop out of your head with Graves. Like, so I don't know, it just, there needs to be that like, okay, you might not know what's going on, so let me inform you. And then I guess, yeah, for everyone else, I think like Barbara hit the nail on the head, and, like people might look at me and go, you're a young, like healthy person, but that's not how I feel on the inside. So I think, yeah, like the really high expectations sometimes is just like, I can't live up to that in a lot of ways. So yeah.
For sure. And thank you, Barbara, for bringing that up too, because I think this is the first time I've left it out of our takeaway slide in a very long time. We usually have our final takeaway, be like, I pulled it up from last month. Do not judge others based on what you can see. You never know what someone is going through. That's kind of like the whole theme of our club is like invisible illness awareness. Like it's invisible. You can't see it. Like it's
Right.
not something you can outwardly see. It's like same thing looking at me. It's like you can't guess that I have like 5 different conditions by looking at me. You can't judge anyone like that. It's like you just have to assume that someone else is dealing with something and don't assume the worst in people. But yeah, for sure. Is there any other comments or things that you guys would like to share, or do we have any questions on Zoom? I know we have a couple people on Zoom or in person. Anyone have any questions for our guest speakers before we kind of wrap things up?
We do have one on the Padlet.
Ooh.
I'm gonna pull that up again. Somebody asked questions for any/all participants. Do you have any stories about healthcare workers or even just friends, family who did or said something that made you feel supported throughout your journey with your conditions?
Such a nice question.
That is a nice question.
I think for me, the person that that it comes to mind is, believe it or not, my husband. When I had found out that I had lupus shortly before I met him, and I was still trying to figure everything out. And when he when he first said to me, "I love you," I said, "But I have lupus." And because I know how stupid is that as a response, but I wanted him to know about it. And he said, "That's okay. I still love you, and I still want to be with you, and we'll, do it together." And he is very much a very helpful husband. He will clean. He will clean with me. He will clean for me. He will cook. He works all day long and comes home and helps me, because as I've gotten worse, I've not been able to keep up with all of the things that I want to get done in the house. And when I was homeschooling all, my 3 sons, that was very time consuming and energy consuming. And he supported me throughout that whole thing. He knew that it was important to me that I homeschool them, and that they learn and it be taken seriously, which took a tremendous amount of time. So it meant he had to do more. I don't know if that answered your question, but hopefully.
I think so.
And yeah, quickly, like my husband's amazing too, and he's very understanding. And I think with anyone recently in my life, like friends or family, if I've ever had to bail on something, just even the whole "I totally understand," like that goes like a really long way, because you feel like you're disappointing people. But yeah, it's just so much extra energy to show up for things, and just their understanding alone is like means everything.
Definitely.
And not just showing up for it, but we all do it. That act kind of that we put on, where we act like we're absolutely okay while we're out and doing something. And that act takes energy, so that when we get home, then we're like, okay, I can let my body fall apart now. and I don't have to act. That takes a lot of energy.
Yeah.
Yeah.
I can't say that there was anything specific to the Hashimoto's, but with the cancer diagnosis that I'm dealing with right now, which I'm doing very well, by the way, just having friends just checking in. How you doing? You know, just giving me positive thoughts, you know, showing care, concern. That's just really helpful in terms of, you know, when I'm really feeling crappy, just having people express care. It helps a lot.
For sure. I can definitely relate, Barbara, with that. Like my boyfriend's, when I said the same thing, he didn't say that like just bluntly, like straight out, but I was like, are you sure? Like we've been together for over 4 years and I'm like, I can count all the things I have. Like, are you sure? It's just like the second guessing. It's like, you're sure, right?
Right.
But like having that support person, especially, it's a really great thing. Other than direct family and friends, I don't know if I have any, I don't know how many positive experiences I've really had with healthcare professionals in general, with them like validating things. I can count the ones that were not. But besides the doctor who like guided me directly to my main diagnosis, everything else has kind of been just self-advocating with family and support people.
Yeah.
You guys had any positive healthcare that you can recall?
Our primary care was definitely, she really is awesome. I recently found out she also has MS, so that's, I think, in part why she understands so much of, you know, the lupus. But not to take away from her, I think she is a fantastic doctor, and she is supportive, and she listens, and she advocates, and I really feel like with her, I could probably tell her anything, you know, and she takes the time. She sits there, she has conversations with you about, you know, my mom, off topic, my mom has Alzheimer's, and recently, when I went up to visit her, my brother neglected to tell me beforehand that she hits now, and she hit me, and it was heartbreaking. And when I told my primary about it, because the stress triggered more pain and just a lupus flare, she actually gave me a lot of empathy, sympathy, and it wasn't even just like a doctor to a patient. It was like a friend to a friend, but in her doctor capacity, if that makes sense.
Yeah.
Um,
That's awesome.
yeah, I wish everybody could have a Dr. Hayes.
Cool. Any other final thoughts or comments by anyone? Well, thank you so much, everyone, all the guest speakers. Thank you for coming and sharing your stories. We really appreciate it. I know I got a lot out of it today. I hope everyone else did too. But we really appreciate you taking the time out to share your experiences and giving us some extra insight into some of these conditions we've been talking about.
Thank you
For having us.
Thank you so much. Everyone get home safe. And
Announcements.
yeah, one quick announcement. I was just about to. We do have an event tomorrow from 9 a.m. to 12 p.m. I will be in Damon tabling. We're going to be the third table, I believe. I'll have the button machine, and you can make any illness themed buttons that Sarah has gratefully, that's not amazingly designed. We have a lot of different button designs, so I bet we have the condition that you do. If you don't, please let us know and we will make it. Or well, Sarah will make it. But hopefully you guys can stop by the button thing tomorrow, and of course you can always make your own designs too. We'll have like colored paper and all that fun stuff and markers, and yeah, but you want to join us for that. And then is it a week from today already?
Yes.
Oh wow, okay. We have a meeting a week from today in this room as well, LSB 212, and on Zoom, talking about well, I know Pans and Pandas is one of them, but just kind of various
ME, CFS, and cystic fibrosis are the others.
we
We're
go.
calling them assorted conditions, basically.
conditions, kind of like wrapping up the year of all
Yes.
the stray ends. And we'll have a trivia event next month and another guest speaker meeting, of course, and we'll give you more detail on that as purchase next week. So watch out for your email for that, and hopefully we'll see you next week.
Yes.
Thank you everyone for coming, everyone on Zoom, everyone in person, and get home safe. And thank you again for taking the time out to come chat with us.
Yes.
Thank you. You guys have a good rest of your semester.
Thank you, appreciate it.
Thanks, guys.
Bye.